Okay, so let's get started. The intention is to keep all webinar participants informed on COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome of this webinar is that you will leave the webinar motivated to create an action plan for yourself and your family, and that secondarily, you'll be motivated to create an action plan for your broader community. Now, this slide, I'm just going to have everybody take a minute and read.
Hello, Dr. Valda?
Yes, I'm going to put you on mute.
Okay.
Okay, all right. This quote is from the World Health Organization's Director General. So what is a pandemic? A pandemic is a worldwide spread of a new disease. It's an infection or something that's contagious that people do not have immunity to. Examples of it are polio, smallpox, tuberculosis, HIV, the bird flu, which was H5N1, SARS, which was a coronavirus, and MERS, which was also a coronavirus. One thing about when there's a pandemic, it impacts everyone. This is just a slide of all of the sovereigns, head of nations that were killed by smallpox. So today we're seeing this now. When I gave this presentation on Tuesday, the following morning, Prince Charles was positive for COVID-19. So COVID-19 is an infectious disease caused by a recently found virus, SARS-CoV-2. Some people call it SARS-2 in the medical community, but in the general public community, it's called COVID-19. Before the outbreak, it originated in Wuhan, China, and it was first discovered in December of 2019. So what is COVID-19 and why is it called that? So it was given the name by the World Health Organization. CO stands for corona, which is Latin for crown or halo, because on a microscope, it looks like there's a crown or a halo around the virus. VI stands for virus. D stands for disease. And 19 is 2019 was the year that the strain appeared. So it's not a very complicated naming system. So why is this so important? We've all experienced a pandemic before. If you're over 65, you may have experienced even more than one. So the final outcome of a pandemic are two things. One, there is a complete cure or a near complete cure. So in 1980, smallpox was eradicated from the world. That was complete. Polio is now near complete. The other thing is it could be a containment or a management where there's no cure yet, which is like HIV. Coronaviruses are among the most oldest viruses. They go back to almost the 9th century BC. So the coronavirus itself is not new, it's this particular strain that is new. So we all know how it spreads, people and surfaces. But I want to go over a couple of things that we may not know about this. So with small droplets, the droplets land on surfaces. The droplets could stay on surfaces for a very, very long time. On cardboard surfaces, it can stay for 24 hours. On plastic surfaces, it can stay 96 hours, which is almost 3.5, 4 days. So it's very, very important to respect COVID-19. Also, it's highly, highly contagious, okay? So if something's contagious, let me go over a little bit about how that's calculated. One is, what is the minimum time that you need to be exposed to this to impact others, to infect others? For coronavirus, it is only 45 seconds. Hold on just a second. For coronavirus, it is only 45 seconds. Also, how many people out of 100, if they were exposed to the disease, will actually contract it? For coronavirus, it's 60 to 80, something like the flu, influenza is like maybe 2 or 3 people out of 20 or 30 people out of 100 would actually, so it has about a 20 or 30% penetration. COVID-19 has a 60 to 80% penetration. So once you're exposed to it, almost everybody gets it. So let's talk about 3 categories of strategies. So preventing it, prevent yourself from getting it, preventing the spread of it, and then what happens if I do get it. So 1, I brought up this slide because we talk a lot about hand washing, and most people do number 1 and maybe number 2. But proper hand washing actually involves the back of the hand, the thumbs, the back of the fingernails, the wrist, and wiping and drying. There's a very good video that the Italians put together using black ink as soap, and that's here, and that shows when you actually do all of these steps, how the entire hand is covered. Now, let's talk about the power of social distancing. This is very, very important. How we were actually going around our daily lives before this happened. If one person was infected, within 5 days, that person would infect 2.5 people. And within 30 days, that person would infect 406 people. With 50% less exposure, one person then infects 1.25 people in 30 days, infects 15. 75% less exposure, which is essentially where we are now. One person in 5 days only infects 0.625 and then 2.5 people in 30 days. So this is why we're doing what we're doing. So protect yourself. It's really proper hand washing, social distancing, covering your mouth with a bent elbow, and trying not to touch your eyes, mouth, nose, etc. So those are all the things that they talk about. Now let's talk about some things that I think are also an additional, I call them Dr. V's guidelines. So the CDC guidelines are good. I think you should follow them. There's just some extra things that I think that you should do. So one is, do not go to the grocery store at all. And I want to repeat this again. Do not go to the grocery store at all. Order your food and medication online. For elderly that are on the computer, call them and walk them through how to do this over the phone. For the elderly that are not on the computer, they can pay you, and then you can order the groceries and deliver them. You can figure out some other way other than actually having them go to the grocery store, or even have someone go to the grocery store for them. There should be no contact with the delivery person, not even a handoff. Bring the delivery into your home and put it on the floor, not a countertop or table or another surface that you normally touch. Transfer any cooked food immediately to your own Tupperware and containers, and get rid of all the cardboard boxes and etc. Throw away any paper or cardboard boxes from delivery. It's important to clean highly used surfaces frequently. I also tell people avoid cash whenever possible. Cash actually flows from person to person to person and is very dirty. Wipe down your credit cards as you use them, and be careful with things like pens and numbers that you're punching on things. Now, this is very important, number 4. Do not get together in small groups with your extended family for the holidays or for celebrations. I know that what is happening is we're getting ready to have Easter come up, and it will be too soon to get together with family by that time. 80% of the people who actually died in China were dying in family clusters. So the families would decide, well, just the 3 of us and the 3 of you get together, and then they all gave it to each other, and the older people in the family had problems and bad sequelae. For those of you who are missing your personal care services, I know some people have arranged for their hairdresser or their nail person to come to their house. Do not go to anyone's home to get your hair or nails done. I don't care if there's just one person there. Do not allow anyone to come to your home and do your nails or hair or face or massage. It's just not worth it at this point in time. Now, I want to talk a little bit about risk factors because I think that there's been a lot of talk about folks with the elderly and folks that have respiratory disease, but there are some very, very specific risk categories. So one is, when they talk about the elderly, they're talking about people that are 65 years or older. And those are people who were born on or before 1955. Now, it does not matter if you're born on or before 1955 and you go to the gym every day, or you run marathons. It doesn't matter. Born on or before 1955. Anybody who lives in a nursing home or long-term care facility, anybody with chronic lung disease or moderate to severe asthma, anyone who has a history of heart disease, immunocompromised would include autoimmune disease, HIV positive, cancer treatments. The next one is very important. Any age with severe obesity is a risk factor. So if you're 20 and you have 20 years old and you have a BMI over 40, you have a risk factor for COVID-19. As far as people who are, the other things to could look at are diabetes, renal failure, and liver disease. People who are pregnant should be monitored, but the CDC does not have enough information to know whether or not they're at increased risk. But in general, when people are pregnant, they are at increased risk for viral illness. So I want to go over what does a BMI of over 40 look like, right? Because so a lot of times people don't know, well, I don't know if that's really me or not, right? So 5'2" over 220 pounds, 5'6" over 250 pounds, 5'10" over 280 pounds, and 6 feet over 300 pounds. At any age is a risk factor. All right, so let's take a look at some of the data coming out of China, because we're starting to get really early data coming out of China. China looked at 1,590 COVID patients. If they had one risk factor, it increased the likelihood of requiring an ICU, respirator, or dying by 79%. If you had two risk factors, it increased the likelihood of requiring an ICU, ventilator, or dying by 250%. When you actually, there was another study where they actually looked at 45,000 patients, and I'll just let everybody read this slide. But this is death rates by a medical illness. So as you can see, certain things like cardiovascular disease gave you a higher risk factor than, let's say, cancer. For men, this is very, very important. Men are at a higher risk for getting the disease, and once they get the disease, they're at a higher risk for doing poorly. So what does that look like? When you look at the COVID-19 infection, 58% are male, 42% are female. That's from the New England Journal of Medicine. When you look at death rate, 2.8% of men infected die, 1.7% of women infected die. So men have almost a 40% higher mortality. All of this data is from the China Center for Disease Control. Italy is having a similar experience in the comment section of these articles, but we do not have data out of Italy, I think just because everybody's a little too busy. Now, for those with asthma or people caring for people with asthma, please do not use a nebulizer if at all possible. This is a droplet disease that actually gives you a symptoms of shortness of breath, so you may think you're having an asthma attack when you actually are having COVID-19. You use your nebulizer, you aerosolize the droplet, and everyone in the home will get it unless they're on a respirator. So what we're actually recommending is that actually people use this device here, which is an inhaler with a spacer. You push this 2 times, the medication goes in here, and you breathe in, breathe out, breathe in, breathe out. This aero chamber or spacer is something that you can actually get as a prescription or order online. It delivers as much medication as a nebulizer. I'm using this in the emergency department. I'm not giving anybody a nebulizer. The other option is that if you have an outside or a garage, you can actually do your nebulizer treatment outside or in the garage, but I would not do it in a closed space like in a home or an apartment or a condo. Now let's talk about action plan, right? You want to stay alert and stay informed. Really the best advice you're going to get is from the World Health Organization. That's the best advice that I actually see that's actually available to the public. What I'm going to actually do and begin to do over the next couple days is on this website, I'm going to actually begin uploading some of these studies so that you can actually take a look at them. Many of them are actually, you don't have to be a doctor to read them, right? They have, and I'm going to have someone do a little annotated summary, but you can also look at the title and look at how they did the study and just, get into it as much as you would like to. For women who are pregnant or near delivery, the CDC has not listed this as a risk factor. However, if I were pregnant and near delivering, I would consider a home delivery at this point in time with a midwife. There was a L&D ward in England, and all of the L&D nurses were positive for COVID. So if you think you have COVID-19, what are the symptoms? So most importantly, you can be positive and transmit the disease with absolutely no symptoms. This is why testing is so important, and I will actually go through that a little bit later. Now, the other thing is that one of the symptoms is that you can have a sudden loss of taste or smell. And that could be your only symptom. There are also a group of people who do not get respiratory symptoms. They get nausea, vomiting, diarrhea, abdominal cramping, right? So there's some people who may not know because they get these other symptoms that they're positive, and therefore they do not isolate. Now, the symptoms that everyone's talking about on the news is the respiratory symptoms. So there's either an upper respiratory symptoms, which is headache, fever, achiness, or a lower respiratory symptoms, which is fever, dry cough, difficulty breathing, and can actually progress to a viral pneumonia. Oh, it is not a good idea. Some people are like, well, maybe I'll just catch the disease to get immunity. So a couple of things. It's not really the best idea. One is you do get immunity after you catch COVID. It is not lifetime immunity. I repeat, you do get immunity after you catch it. It is not lifetime immunity. So it is immunity that seems to wear off. And then if you catch it again, you may have a milder or equal or similar sort of experience. What happens is this virus sits in the lungs and it appears like ground glass by CAT scan. It causes pulmonary scarring and fibrosis. When you have viral pneumonia, 50% of the people die. And that's all of the things that you're hearing about as far as ventilators and use of ventilators. For those who survive, which is the information that they are not giving on the news, 30 to 40% of them have decreased lung capacity and are experiencing just problems breathing with normal walking. So this is not a disease that you just want to catch. There's been some back and forth. The World Health Organization said you should avoid taking ibuprofen. It might make COVID-19 worse. Then they walked that advice back and said, no, it's okay to take ibuprofen. Paracetamol is just what they call Tylenol in Europe. I personally would just use Tylenol unless I really, really needed to use a Motrin or a Aleve. 2, do not go to the hospital unless you're really, really sick. The hospital is not a clean place right now. So in China, they did a much better job separating COVID positive patients from COVID negative patients. And they also did a much better job of testing medical providers daily when they came to work. We are not doing that. So we have these COVID patients all over the place. So, if you sprain your ankle or cut your hand or I don't know, have something else that's going on, I would not go to the hospital unless you really, really need to. A lot of people ask me about testing. Unfortunately, the testing varies by state. It would be ideal if we had testing that was federally and similarly mandated across state lines. How do you win against COVID? Early detection and early response are the key. Testing, testing, testing. Also, universal precautions. So universal precautions mean I assume I have COVID-19. I assume you have COVID-19. You assume you have COVID-19. And you assume I have COVID-19. And then we act accordingly, right? So if you knew you had it for sure, or if you knew someone else had it for sure, act like they do. So what's next? Continued social distancing until we've turned the corner. Australia actually closed down for 6 months. I know we actually closed down for 15 days. I believe that is absolutely going to have to be extended. Some people have asked me, how will you know that things have turned the corner? I would say to people that, you'll know when things have turned the corner because they'll have the Tokyo Olympics. The NBA will be playing to a live audience. Also watch your doctor's offices because they're not going to let you back in there till they think it's really over. So if your doctor is still not seeing you, you shouldn't go to work. If your employment is significantly impacted by this, I would really consider looking at what you can do remotely, or what sort of gig you can get online. A vaccine is about 12 to 18 months away, which would be quick. Once it actually comes out, they'll probably give it to essential workers and then move it on into the general community. But I do think that, if we could get a vaccine in 12 months, that would be great. In the meantime, what they are doing for the patients that are really, really sick are plasma transfusions from folks that have had COVID-19 to help get them over the hump of the disease. The importance of testing. I wanted to actually go over this. Voi, Italy was the place that had, or Voi, Italy was the place that had the first COVID-19 documented disease in Italy. It's a small town of about 3,000 people. They started out just testing the people that were symptomatic, and they were not able to get rid of the disease. Against public health advice, they actually decided to test everyone. When they tested everyone, they found about 12% of the people that were COVID-19 positive and asymptomatic. They had them self-isolate and quarantine for 14 days. After 14 days, 6 were still COVID positive. They had to do another 2 weeks. And then they were able to actually finally get Voi, Italy, COVID-19 free. So I say to everybody, respect COVID-19, create a plan for you and your family and your community. Look at the things that you're doing every day. How do I handle a delivery person? How am I dealing with groceries? Where are the contacts that I'm actually having? How can I minimize that? Take a look at what you're doing and look at how you can actually ramp it up even further. We set up this Twitter account so that we set it up today so that we can actually interface and work with people. So if you see this, that is us. And there's all my information.